This video consent is presented today to discuss the procedure called pacemaker insertion. We want you to be actively involved in your care. Please feel free to ask questions at any time. You can pause, restart, and review sections of the video using the buttons above. It's important that you understand the information we provide so you can make the best decision for yourself. A pacemaker is used to help people with heart rhythm problems, also called arrhythmia. These problems can make it hard for your heart to pump blood properly. Your doctor may recommend this procedure if your heart beats too slowly or if the signals that control your heart don't work right. Pacemakers can also help if you have a fast and slow heartbeat, a condition called tachybrady syndrome, or if medications for arterial fibrillation slow your heart too much. Other reasons for a pacemaker include heart failure or conditions you were born with, like congenital heart disease. Symptoms that may mean you need a pacemaker include fainting, feeling very tired, shortness of breath, chest pain, or feeling confused. The pacemaker procedure is usually done by a cardiologist in a hospital. First, the doctor gives you medicine to numb the area near your collarbone, and you may get medicine to help you relax. A small cut is made near your collarbone, and thin wires, called leads, are placed into your heart through a vein. The pacemaker device, which is small and battery-powered, is connected to the leads and placed under your skin. The doctor will test the pacemaker to make sure it works correctly. Finally, the cut is closed with stitches or surgical glue, and a bandage is applied. A pacemaker helps your heart beat at the right speed and rhythm. It can reduce symptoms like dizziness, tiredness, and shortness of breath. Many people find that their quality of life improves and that they can do more activities without feeling as tired. Pacemakers also reduce the risk of serious heart problems caused by arrhythmia. Like any procedure, pacemaker insertion has risks. These risks are grouped into common, less common, and rare categories based on how often they happen. Common risks: 10 out of 100 patients. Bleeding or bruising around the cut is common. You might also have mild swelling or soreness near the pacemaker. These usually get better with time and rest. Less common risks: 2 out of 100 patients. Some people get an infection at the cut, which may need antibiotics or another procedure. The wires inside your heart can move out of place and need to be adjusted. Rarely, placing the wires may cause damage to your heart or blood vessels. Rare risks: 1 out of 100 patients. A rare problem is a collapsed lung, which can happen if the lung is accidentally punctured. Allergic reactions to medicines or materials used in the procedure are also rare. Another rare risk is pacemaker syndrome, where the device doesn't fully sync your heart chambers, causing tiredness or dizziness. Scar tissue may also form around the wires or device over time. Other possible issues: pacemaker batteries last 5 to 15 years and will need to be replaced in another procedure. There is also a small chance the pacemaker may not work correctly and need reprogramming or replacement. Your doctor will take steps to reduce these risks and make sure you recover properly. If your doctor has recommended a pacemaker, it's likely because your heart rhythm disorder cannot be managed well with other treatments. However, there are alternatives you may consider. Medications can sometimes help manage certain arrhythmia, although they may not be enough for more serious conditions. Another option is catheter ablation, a procedure that targets the heart's abnormal electrical signals. For some people, an implantable cardio defibrillator, or ICD, may be recommended. Lifestyle changes, such as improving your diet or exercising, might help manage mild symptoms. You may also choose to do nothing. However, for some conditions, like complete heart block, avoiding or delaying a pacemaker could lead to serious complications, such as fainting, heart failure, or sudden death. Your doctor will discuss the best options for your specific situation, including the risks and benefits of each. To reduce risks, your doctor will give you instructions before the procedure. This may include stopping certain medicines or not eating for several hours. After surgery, follow your doctor's recovery plan, avoid heavy lifting, and watch for signs of infection, like redness or swelling near the pacemaker site. By proceeding, you confirm that all aspects of this procedure have been explained in terms you understand. Your questions have been answered, and you're aware of both the potential benefits and risks. While a successful outcome is sought, it cannot be guaranteed. Thank you for taking the time to understand this important information.